Physical examination of the wrist can also be broken down into compartments: the dorsal compartment, the volar compartment, the radial side compartment, and the ulnar side compartment. They can also be broken down into acute traumatic injuries and overuse injuries. Common problems seen in the primary care office include tendinopathies, ganglion cyst disorders, traumatic injuries such as scaphoid fractures, distal radius fractures, and nerve disorders such as carpal tunnel syndrome. Examination of the wrist begins with inspection, looking for generalized or focal swelling or any focal masses that may be indicative of a ganglion cyst. We're going to move on to the range of motion part of the examination. Start with the elbows fully extended. We're going to check dorsiflexion, volar flexion, radial deviation, and ulnar deviation. Certain disorders of the wrist can also affect pronal supination movement, so again we look at pronal supination. Supination, palms up; pronation, palms down. And you're also looking for asymmetry between the two sides. We're going to move on to the palpation portion of the examination of the wrist. Again, it's easier if you think it in compartments: dorsal compartment, radial compartment, ulnar compartment, and volar compartment. First, palpating the radial ulnar portion of the wrist, the distal radius, the distal radial ulnar joint, and the ulnar styloid. Moving on to the carpal bones, the scaphoid, the mid-carpal bones, and the TFCC, the triangular fibrocartilage complex. Also in the dorsal, radial, and ulnar side of the wrist are a number of tunnels called the dorsal tunnels, which basically hold the various tendons of the wrist, the dorsal tendons of the wrist. First dorsal tunnel is the site of the Quervain's tenosynovitis. Other areas of tenderness along the tendons include other extensive tendinopathies and the extensor carpi ulnaris. On the volar side, you can check the carpal tunnel and the neurovascular structures such as the ulnar nerve and the radial nerve. Now we're going to talk about special tests of the wrist. Again, we're talking about tendinopathies, so muscular tendinous unit type problems. For those, we check manual muscle testing. Wrist extension, checking for extensor tendinopathies. Another common problem is the Quervain's tenosynovitis. Extend the thumb and check for pain along the first dorsal compartment. Another provocative test for this disorder is called Finkelstein's test. You have the thumb inside the fist, and you're going to ulnar deviate both wrists, checking for pain along the dorsal radial aspect of the wrist. Other special tests include checking for nerve disorders such as carpal tunnel syndrome. Carpal tunnel is located in the mid portion of the volar aspect of the wrist. Phalen's maneuver can be done with the wrist in maximum amount of volar flexion. Reverse phalanx can be done in maximum amount of dorsiflexion. The patient can also put both hands together in a prayer position or reverse prayer position. You can also provoke carpal tunnel symptoms by tapping over the carpal tunnel, which is called carpal tunnel tunnels, checking for paresthesias, numbness in the median nerve distribution, which includes the thumb, index finger, middle finger, and half of the ring finger. When checking any type of nerve disorder in the wrist or in the hand, gross touch to sensibility should be inspected, capillary refill, and checking for pulses, as well as checking the strength of certain muscle groups. With respect to the median nerve, a good way to check motor test is to check the APB, or the abductor pollicis brevis. One easy way to do that is to have them place both palms on their laps, have their thumbs abducted or pointed toward the sky against resistance, straight down. You can also see thenar atrophy as you're testing the abductor pollicis brevis. This is a close-up view of testing the motor strength of the median nerve. We're going to test the thenar musculature, or the abductor pollicis brevis. Palm is laid flat on the lap, thumb is abducted, and you're going to apply a force directed straight down. You can also check for thenar atrophy. Provocative tests for scaphoid injuries classically begins with palpation over the anatomic snuff box, the borders of which are tendons of the thumb, including abductor tendons and extensor tendons. Direct palpation. Other provocative tests include axial compression of the thumb, causing pain in the anatomical snuff box area, as well as forced dorsiflexion or forced radial deviation.